Welcome friends, I am Dr. V.K. Chauhan, homeopathic physician, and we are revising homeopathic remedy Calcarea arsenica. This is part 2, general overview in classical format. The text is taken up from Allen's Keynote, and this is good study for BHMS students and interns. So general information we'll take up first, which is not given in Allen's Keynote, and that is first the remedy profile. This is a small remedy but important remedy. Kingdom belongs to mineral kingdom. We have the source of this remedy is a chemical compound of calcium and arsenic. The formula is Ca3 2ASO4. The preparation: triturations are prepared with the sugar of milk and the salt. This remedy was proved, as we know, Dr. Contestine hearing in 1848. The organ tissue affinity or the sphere of action is the mind, thermic center, nerves, heart, liver, spleen, blood, kidney, mucous membrane. The review we are going to take up now from Allen's Keynote. The constitutional components. The somatic aspect, best suited to fleshy women when approaching the menopause. Thermal affinity, patient is chilly. Side affinity, left lateral affinity we find in this remedy. Psychic preponderance, the temperamentally patient is melancholic. The psychic preponderance in the mental sphere, again we find that there is a great mental depression, anger, anxiety, desire for company, confusion, delusion, illusions. These are the symptoms given in Boric Materia Medica. The dreams of the dead. This is the third grade representation in Kent repertory. Desires wine, and we have no specific aversion for in this remedy. Let us go to the causation. In causation, we see first the diathesis. Complaints of fleshy women approaching the menopause. We have the constitution and predisposition with particular patient who is supposed to be the female. The more preponderance drug is having female predominance looks like here. Ailments from epilepsy, from valvular heart diseases. The slightest emotion causes palpitation of heart. The complaints of drunkards after abstaining, craving for alcohol is marked. We go to the particular generals. We have the head section, rush of blood to head and left chest. Now we go to the relationship. Compare this remedy with conium, glonine, lithium carb, pulsatilla and naxomica. This remedy follows well after conium in lymphatic, psoric or tubercular persons. General modality is the aggravation is slightest exertion and emotions. These are given or taken up from Boric Materia Medica, and we don't have very specific symptom here in relation to amelioration. The miasmatic orientation, the miasmatic markers we are going to use here. Number one is albuminuria and second is the valvular heart disease. Both of these point to psychotic trait. CA uterus and pancreas. This information is from Boric Materia Medica. This points to syphilitic trait. So our impression, overall impression is that the Calcarea ars is a predominantly psychosyphilitic mixed miasmatic remedy where Sora is in background. The posology part, the doses best suited 6 to 30th potency we have, and this is taken up from K. N. Mathur. Repetition may be repeated till the response is noticed. Information is from K.N. Mathur, and duration of action is we are not sure about it. The applied part, clinically we find this remedy is useful in albuminuria, or you can say nephritis, depression, alcohol addiction, alcohol withdrawal, menopausal syndrome, palpitation, valvular heart disease, epilepsy, and CA pancreas and CA uterus. So friends, thank you very much for your patient listening.